Hi everyone, this is Moo, and today we're going to talk about some unconventional or weird, perhaps strange explanations for anxiety and panic that your allopathic doctor probably either doesn't know about or isn't aware of or doesn't understand the connection. Okay, first I want to say, because I realized I recently heard somebody talking about anxiety, and I see that there's still a misperception about it, that it's a psychological or mental illness, and that's just not the case. Anxiety is not psychological, it's physiological. It's just your body doing what it naturally is supposed to do. It's a natural defense mechanism that has evolved to protect us from harm or potential harm or danger, even if there isn't any. So what's happened a lot of times with anxiety is that our nervous system has just become highly sensitized, or perhaps overly sensitized. So it's very sensitive to any sort of stress or stressors, and that's where the anxiety and sometimes the panic kicks in. So that's all it is. It's normal, it's natural, and there are treatments for it, natural treatments for it. With a sensitized nervous system, the amygdala is on high alert. So it's just like I said, it's just doing what it's supposed to do to help us survive, but it's basically being over vigilant. So a technique that's worked for me personally is to retrain or desensitize the amygdala. And I've used Ashok Gupta's amygdala retraining program. And if you go to planetmoo.com, that's planetmoo.com, to the products that I recommend, you'll see a link to the amygdala retraining program. I've used it for about 5.5 years, and it definitely works. And I've also developed a method that will quickly reduce and eliminate any symptoms of anxiety. And I'll probably most likely be using that in private holistic healing consultations with people in the future. Okay, so we're going to talk about 4 alternative causes for anxiety and panic attacks. And the first one is inner ear disorders. They definitely can cause anxiety and panic attacks. And there's a doctor named Harold Levinson who discovered that link, and he's written about it in his book called Phobia Free. And that book may actually be out of print, I'm not sure, but there are people selling it on Amazon, and if you can get your hands on one, if you do have an inner ear disorder and anxiety or panic, I highly recommend it. I also put a link on my website, planetmoo.com, and it's in my Amazon shop as well. If you want to find out if you have an inner ear disorder that might be causing your anxiety, you'll have to find an ENT, an ear, nose, and throat doctor who understands that link, who knows about that link. So I would, if you're going to make an appointment, I'd be sure to check if they do know about that. It's one of the reasons I had vertigo and severe anxiety for years, but it was never diagnosed. I discovered it myself. And the only thing that worked for me, because I don't take prescription medications and I do not recommend them, I would, if it was really bad, I would take a quarter, maybe a half of a meclizine tablet. Okay, meclizine works very well because it works on the inner ear. And it's sold over the counter as Dramamine, or as a motion sickness medication. But there's 2 types of Dramamine, so you want to read the label and make sure that you're getting the one that's the meclizine. And I'm not sure offhand right now if that's the one that is considered the non-drowsy formula or the other one. But if you're unsure, ask your pharmacist and make sure that you get the meclizine one. And start out with a really low dose. You know, cut up the pill into a quarter or a half like I did. And generally that's enough to get rid of the anxiety or the panic. Okay, number 2. The number 2 alternative anxiety cause that I'm going to talk about today. And this may seem weird or crazy, but it's not. There's a definite link. And that is hiatal hernia syndrome. Allopathic medical doctors aren't going to know about this in general. There may be a few. Some chiropractors do know about this. They are aware of it. But again, you want to check and see if they know about the hiatal hernia anxiety connection. Dr. Theodore Barodi, who is a chiropractor, has written pretty much the Bible on hiatal hernia syndrome, and it's called hiatal hernia syndrome. Dr. Barodi. Again, I have a link on my website and in my Amazon shop, Planet Moo. He calls it the insidious link to major illness. And it really is, because when the hiatal hernia, basically the stomach raises up into the opening of our diaphragm where the esophagus comes through. And it can either put a lot of pressure on your diaphragm, or it can literally work its way up through that opening, or there might be a tear in your diaphragm or other things like that. And it can pinch the vagus nerve. Okay, the vagus nerve is called the wanderer because it's interconnected with all of our organs. Look at this. I mean, it's amazing. There's the right vagus nerve and the left vagus nerve. Comes on down, connects to our lungs, our stomach, our liver, spleen, everything. Look at it. It goes all the way down, intestines, colon. It's actually quite amazing. So when that vagus nerve gets pinched, it's called a vagus nerve imbalance, VNI, and you can Google that if you want more information. And it causes hyperexcitability, okay? In other words, anxiety. And it can cause decreased energy. And it can basically affect many of your organs, cause all kinds of symptoms. But again, it's going to go undiagnosed with an allopathic doctor in general. And as I said, some chiropractors know about it, and it can be treated. It can be treated at home, and it can be treated by a chiropractor. And in Dr. Brody's book, he talks about different treatments, and they're very simple. Most of them are very simple. It's just a simple manipulation of the stomach, pulling it down, and you can do the manipulations yourself and other stuff once you know about it. And also, Donna Eden has a treatment in her book, Energy Medicine, and again, that's one of the books I recommend, so it's in my product recommendations on my site. Very simple, it works, I've done it, I've used it, and I've had hiatal hernia syndrome and vagus nerve imbalance, and that's caused a lot of my anxiety through the years. So again, it's treatable, you can get rid of it, okay? The third alternative cause that I'm going to talk about today is neck, back, and spine vertebrae misalignment. You know, our spine just has an incredible amount of nerves attached to it, going again to all our organs and muscles. And when our muscles are tight, it can pull the spine out of alignment. It can pinch nerves, like the vagus nerve and in the stomach diaphragm region. It can cause inner ear issues and therefore anxiety, panic, as we talked about. It's all connected. So you want to focus on, like, even if you have misalignments in your lower or mid back, it's going to cause misalignment in the axis, atlas, upper cervical spine region, particularly the atlas. Look at the C1 vertebrae, okay? That affects the blood supply to the head, okay? It affects the pituitary gland, the scalp. Sometimes the scalp gets very tight when people have anxiety, can cause headaches. It affects the brain, and here we go, the inner and middle ear, right? Okay? And that causes anxiety, panic. But here's the big one. The atlas, the C1 vertebrae, affects the sympathetic nervous system, all right? That's out of alignment, which it often is in people that have anxiety and panic. So, you know, here's the possible symptoms: headaches, nervousness, right? Insomnia, head colds, high blood pressure, migraine headaches, nervous breakdowns. In actuality, there's no such thing as a nervous breakdown, but Dr. Claire Weeks calls it nervous illness. That's chronic anxiety, panic disorder, things like that. Okay, can cause chronic tiredness and dizziness. So what you want to do definitely is you want to get yourself, your spine and your vertebrae in alignment as much as possible. So you can do that by going to a chiropractor. There's exercises you can do at home. I suggest hatha yoga. It's excellent for that kind of thing. So however you can, you want to get it back into alignment. Okay, now the fourth alternative cause that I want to talk about may seem very strange or weird or out there or whatever, but it's pretty common knowledge that earth changes are happening right now, and we're all experiencing that, and we have been for some time. Now here's the thing. As humans, we are in three-dimensional bodies, okay? Our planet Earth is actually raising its vibration, okay? It's raising its to, if you want to say a higher level in hierarchical terms, but it's adjusting, okay? And we know that it is, the vibration is speeding up. So our bodies and all life on Earth are having to adjust to these changes in the planet. Atoms and the atoms in our bodies are also vibrating at a higher or faster level. And if not, we're having to adjust so that we can. So we have this impression, or our body does, or subconsciously we do, that time is speeding up. But of course, time isn't speeding up, not really. You could say that creation is speeding up, or consciousness is evolving, or speeding up, or raising. That's a better term for it, maybe. And again, that's linear, hierarchical terms, because ultimately we are beyond time and space. But right now I'm speaking of 3D, and Earth is raising into 5D, okay? So it's all an adjustment, and it's going to cause anxiety. It's going to just naturally cause anxiety when we feel our atoms speeding up. That's just natural in my mind. So the shift, can cause what's being experienced as anxiety, and, as the body, the physical body, adjusts to the higher rate of vibration. It's a process. And some people say that we are having to break through trauma blocks. Perhaps that could be equated to what Eckhart Tolle calls the pain body. And there is a collective pain body as well, as a personal pain body, individual pain body. There's also a theory that we are activating or currently waking up dormant, unused DNA, because we currently are only using 10 to 15% of our DNA for biological processes, and the rest of it is pretty much a mystery. So, in closing, in reality, the truth is there is really nothing wrong with you or me or anyone else. It's all just part of a story that we tell ourselves, and it seems very, very real. It seems very real, and these symptoms seem very real, and that's what I'm dealing with right now. That's what I'm talking about right now. I'm discussing the basics right now. I'm going to get to the other stuff later. And in the next video, I'm going to talk about some specific things that I do and that I've done, and that you can do too, to help yourself if you suffer from anxiety and panic or multiple chemical sensitivities, any number of other things. So peace and blessings to you. Until next time.